Hello and welcome to the I Can Do podcast with Benjamin Lee. We're here to talk about tips and strategies to have an I Can Do mindset when it comes to faith, family, fitness, and food. Let's go. Here's your host, Benjamin Lee.
Hello and welcome to another episode of I Can Do. This is Benjamin. I hope and pray that all is well with you. And I hope you are safe today, and I hope your family is doing well. Well, our lives have certainly changed this past week. You can really say the last couple of weeks, the last month, but even more so. The United States of America, things have drastically changed, not just in the United States, but really around the world. My wife and I and my son, I did a podcast on this called Put It in the Calendar. We sat down at the dinner table back in December, and we put a lot of things in the calendar. Well, a lot of things have now changed as a result of the COVID-19 coronavirus. We have all seen the impact of what has taken place with respect to our jobs, the economy, and even when it comes to gathering together as Christians and worshiping God on the first day of the week as a family. So this episode, I want to talk a little bit about some things that all of us can do. In particular, I want to talk about how we can help our healthcare providers. I've been listening and reading different things, and it's becoming more and more clear how serious the coronavirus is, how we all should be taking this very seriously, and the danger to our healthcare system. With respect to it being completely overwhelmed. And so I want to talk a little bit about how we can help our healthcare providers. I read a tweet yesterday from Tim Ferriss. He's written numerous best-selling books and has a really popular podcast and has written numerous blogs, and I've been following him for a couple of years. And he talked about the importance, the necessity of really talking to as many people as possible and sharing with others what we might be able to do and understanding just how significant this really is with respect to our healthcare system and the danger that it is facing those who are a part of it, the doctors, the nurses, all of the staff who play just a critical role, and how they are being overwhelmed and don't have some of the basic necessities that they need when it comes to helping others with coronavirus and also even protecting themselves. And so I wanted to talk about this on my podcast. He talked about others who had a podcast to share and to talk about this. And so that's what I want to do. As you know, we understand the importance of doctors and nurses and everyone who plays a vital role in our healthcare system. And I am certainly thankful for them and for all that they do. I've seen firsthand being in pharmaceutical sales for 8 years. It seems like a really long time now, but from 2001 to 2009, I worked with Pfizer Pharmaceuticals. And so I was in the doctor's offices, I was in the hospitals, and I saw the hard work that really goes into what physicians and nurses, what they do on an everyday basis. And then personally, I've been in the ER, I've been in the hospital quite a bit the last decade. And back in 2010, I got my first defibrillator. And so I was in the hospital for that. In 2014, I had a blood clot in my right coronary artery. And so I was in the ER for that and in the hospital for a few days as well. In 2016, I got my second defibrillator. And then in 2019, nothing with my heart, but I had an accident. I was in the attic and my foot slipped and I fell. My foot went through the ceiling. And so I had to go to the ER for that. So I'm thankful for the physicians who are there, who were able to help me and to provide for me. And my wife would say the same. She's been in the hospital quite a bit as well. And so it's such a blessing to be able to know that we can go to the hospital, that we can go to a clinic, and that we can get the necessary assistance and provisions that we need. But with the coronavirus, a lot of things are changing. And there is a great danger with our system being overwhelmed where physicians and staff are going to run out of the basic necessities that they need in a few short weeks. I took my son to the pediatric office last week. He had a fever. and thankfully he's doing well. He doesn't have the flu or strep throat. Symptoms have gone. But I talked to the nurse practitioner, and we naturally started talking about the coronavirus. And he had a mask, because I had a mask. My wife bought some back in, when was that? The last part of January when I had the flu. And so she had that for us at the house. And the nurse practitioner was just telling me how at the pediatric clinic, they were almost out of masks. And they only had a limited amount. And so that was last Saturday. That's not the ER. That's a PEDS clinic. And so that was a wake-up call for me, and also a reminder that those who are working so diligently, countless hours assisting those who are in need, they need as much support and assistance from us as well. So we're not being melodramatic. We're not trying just to get attention. When we talk about this is something that we all really need to be aware of, and really try to do the best that we can do to assist those physicians and nurses. So I want to give you some thoughts that we can do to do our part when it comes to helping those healthcare providers. Number one, let's pray. Let's pray for those men and women and for the work that they're doing. They're working very hard, so let's be praying for them. Number two, when we get an opportunity, let's say thank you. You probably know a physician. You probably know a nurse who's been doing a lot. When you get the opportunity, say thank you to them. Saying thank you will go a long way to encouraging them. They're working many long hours, and they're putting themselves in harm's way, and they want to. They want to help people. That's what they signed up to do, but they also need encouragement as well. So let's say thank you. Let's do the basics. I talked to a friend of mine. She's a nurse, and I asked her, what would you want me to share with others? And so she started off by saying, do the basics. And here's what she meant by that. Be considerate. Don't go into the clinic or hospital for something that can be done over the phone. That's something that's been brought up to me as well by a friend of mine who is a physician. Unless it's absolutely necessary, don't go into the hospital. My friend also mentioned social distancing is necessary. It is something that we all should take very seriously. Don't share information that has not been confirmed. On social media, it's been good to actually keep up with a lot of things, but it has also been challenging because sometimes you don't always know what's true and what may not be true. She then went on to say, stay home when you're sick. That's a great point. Stay home when you're sick. Wash your hands. We've seen a lot of videos with that and how long we should wash our hands. That really is a big deal. I really liked what she said next. She said, love your family. She said, love your family. It can be very easy to take for granted. And she also talked about not complaining about staying home when you have no choice. Listen, if you're healthy, that's a blessing, and that's reason to be thankful to God. And so let's be careful even with our complaining. I know our schedules have changed. Our lives have drastically changed. But this is another opportunity to really appreciate our family, to appreciate the blessings that we have. So I wanted to share those thoughts. I thought those thoughts were very good. I talked to another friend of mine who is a nurse, and she talked about also the need for masks and gloves and hand sanitizer. And if you have extra of those in your house or your workplace, take them to the nearest hospital to donate. And if they decide to still use them, then there you go. But that's something else that we all could do as well. Listening to Tim's podcast and then reading his blog, he has put together a website where he will be sharing more options if you like to stay up to date with some other things that you may be able to do. So I want to share the website. It's www.tim.blog/fight COVID, COVID. And so you can go there and sign up via email. And when he gets information with vetted options of other ways to help, you'll be able to know as well. There's also another website that he had. It's called flexport.org, flexport.org/donate. And that's a website that you can go if you want to donate financially to be able to assist in helping those in the healthcare system and hospitals that are in need as well, and making sure that the necessary supplies are going to be there for those who are working really, really hard. And then there's a third website that I want to share with you for those who are in need, who have been impacted by the coronavirus and may be in need with food or paying bills. There's a website called findhelp.org. 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 And you can go there and you can put in, a person can go there and put in their zip code, and then they'll be able to find resources in their community. So I'm just trying to do my part, and I think every little bit helps. And I hope you'll be able to share this and to consider some things that you can do. We all can do something, and we all can encourage those who are in the healthcare system, who are doing so much as a healthcare provider and assisting so many other people. So again, thank you for all of those who are working diligently to keep us healthy, and who are working long hours. Let's be praying for them, and let's do all we can. And as well, let's make sure that we trust in God during this time. I'm going to be doing a sermon tomorrow, and I'm going to be talking about obviously trusting in God. And we trust in God, and we do what we can do as well. So let's do the best that we can do. Let's encourage those who are in need at this time. I hope this helps. Take care, and God bless. And remember, I can do, so can you.